Assalamu alaikum, and my best wishes to all the students. So today we'll be talking about national policy related to health, especially national health policy and other related policies, and then we'll be briefly discussing Millennium Development Goals and Sustainable Development Goals. Okay, so by the end of this session, the students will be able to enumerate various national health policies related to health. They should be able to describe salient features of health policies and to be able to describe briefly the objectives and strategies of Millennium Development Goals and Sustainable Development Goals. Okay, let's start. We first go through this vignette, and you can see the vignette goes like Savita, who lived in a poor village in South India. When she first became sick, she visited an unlicensed doctor. She did not recover and then went to a practitioner of Indian system of medicine. After the 2 weeks of illness, she went to the outpatient clinic of the main hospital. By the time Savita had begun to recover, she had spent the equivalent of $20 on services and transportation to get to them, and she had also missed 2 weeks of work, in which she lost another $20 of income. The total cost of this illness was about 10% of her annual earnings. Now we can see from this vignette what we derive is that one is poverty, which obviously is rampant. Then second thing we can see is the non-availability of health services, not easily available. The poor quality of healthcare, whatever is available at that point in time, lack of social security, and then the cost of healthcare. And we know that it's a known fact that a lot of people are pushed into poverty because of the cost of healthcare, what we call the catastrophic health expenditure. Therefore, it makes very important for the governments to put up with ideas and solutions, and they usually come up with what we call these policies. So this actually it makes it possible for us to look at why policies and why do we need policies in healthcare. Now, first looking at what does a policy actually mean. So policies are courses or principles of action adopted by proposed by government. Now, and the national policy statements inserted by Government of India as a blueprint for further action about the manner in which tasks related to health and health subjects need to be performed. So they give us a framework and the directions and strategies how things have to be done. Okay, now why do we need a health policy as such? So there are some important things that we need to keep in mind. First, that we have limited resources. Our resources always fall short of requirements, therefore we need to prioritize. So these government policies help us to prioritize those issues and then allocate resources. Then health policies are very important. They are intended to achieve a level of health for all, because government has to take care of all the people, both the people who are vulnerable or are less vulnerable or otherwise. And therefore, and importantly, policies have to have a legal backup, because governments want the authorities and departments to follow those policies. Therefore, it needs to have a legal backup so that these policies can be enforced. Here's some of the health policies which are actually being implemented this time in India. So there are some of them, and there are many more of them also there. We have a national health policy, recently formulated now 2017. We have a population policy 2000, nutrition policy, we have a vaccine policy, mental health policy. We have a national AIDS prevention control policy. We have policy for persons with disabilities. We have a policy for children. We have a national housing policy. Now, coming to the national health policy, which was first formulated in 1983, at that time the policy basically had a primary focus. Emphasis was on small family norm, maternal and child health, immunization, improving nutritional status, environmental protection, school health, and food safety were also added. And therefore, but then this policy was revised in 2002 because of certain reasons, primarily because of the financial position of the country at that time. So the revised policy basically wanted to achieve good health in people by increasing access to health care, improving primary health care level, promoting national use of drugs, increasing health investment, and enhancing the private sector participation. So the goals that were set at that time were primarily we looked at the eradication of polio, which obviously we have not eradication but elimination we have achieved, and yours has been eradicated. They formulated a goal in terms of elimination of leprosy, then Kala Azar, lymphatic filariasis, achieve a zero level of growth, HIV, AIDS, and others, as you can see from this slide. But But then this policy again needed revision, which was done recently in 2017. We came up with a national policy. So why was the reason required? This revision was basically one, there are changing health priorities because the country is going through epidemiological transition. On the one hand, the communicable diseases are becoming less common, while on the other hand, the non-communicable diseases are on the rise. Therefore, we need to change our focus. We need a framework of direction how it has to be done. Then there is an emergence of the robust private industry, which is growing at a very high speed. Therefore, this industry has to be regulated because private industry primarily has a profit as their main focus. So, to protect the vulnerable and population, policy government has to regulate this industry. And then third thing is the out-of-pocket expenditure is growing. People are preferring to go to the private sector, but at the same time, this is contributing to the poverty, what we call was labeled as catastrophic expenditure on health. Then there is economic growth, which has increased the capacity of the government, the fiscal capacity, which means that the government can invest. Therefore, we can look at expanding our healthcare system. So therefore, we needed a policy, a revision, which was brought about in 2017. Now, the main objectives of this policy were to uh, inform, clarify, strengthen, and prioritize the role of government in shaping health system and its dimensions. And with specific objectives were concerned, it was improving population health, so conserve population action, reduce out-of-pocket expenditure, ensure universal availability of healthcare, healthcare to be available to everyone, each person in the country, ensure access to essential drugs, diagnostics, emergency care, improve access and affordability of using private public partnership modes because in many areas the government is not able to provide services and those areas private sector can help, but private sector has to be regulated by the government. Then influence growth of private healthcare industry and medical technologies because we know it's on the rise and evolving and therefore it has to be looked into and covered in the policy itself. Now the main focus areas was for increasing public expenditure from the current level of 1.1% to 2.5%, ensuring 200 beds per million population. Then like initiatives like Swasth Nagarik Abhiyan, where we're stressing prevention of disease and promotion of good health, shifting from selective primary health care service to more comprehensive health care, making healthcare accessible, empowering citizens, and ensuring periodic accreditation of healthcare institutions, establishing a national healthcare standards organization where they will be assessing institutions and other healthcare institutions for their quality of care, so we can maintain a good quality of care. And then we need to have a national level health information system, what we call a national health information network should be there. And they were looking at specific quantity goals, objectives. One was in terms of improving health status and looking at program impact should be by means of improving life expectancy, reducing mortality by age and cause, and reduction of disease prevalence. Then health systems performance, while we're looking at improving coverage of health services, and even looking at the cross-sectoral goals like reducing tobacco, reducing occupational injuries, reducing road traffic accidents, and other things. Then health system performance will be in terms of improving health finance, increasing our expenditure from 1.1% to 2.5% of GDP on health, improving our health infrastructure and manpower, and ensuring a national level health information network. Then the post thrust obviously is on ensuring adequate treatment, preventing and promoting health. Organization of healthcare means healthcare needs to be organized both at primary, secondary, public health system, even at tertiary level. Then our national programs, they will need strengthening and better control and better so that we can have a better impact from these programs. Then we have a national nutrition policy framed in 1993. So primarily it was framed that time because of the rampant malnutrition in the country. So it laid from emphasis on provision of basic nutrition services to the population in general and to the vulnerable population in particular. Now the strategies were primarily at two levels. One was the short-term strategy, which aimed at expansion of the integrated child development service throughout the country, which obviously we have done by now. An extension of supplement nutrition by other vulnerable groups like pregnant ladies and nursing mothers and others. Then bringing adults and girls into the provision of the ICDS, which already has been done because there are a lot of schemes which are being covered, which cover the adolescents, where we provide them nutrition and iron folic acid and then education, the life skills. And then extend other strategies like intensifying vitamin prophylaxis and providing iodized salt and other things. Then in indirect goals, there was The objective was to look at improving the food production availability in the country. By increasing food production, we need to ensure increasing better per capita availability of food, then enforcing some of the land reforms, then ensuring strict implementation of the Food Allocation Act, then provision of special rations to the landless landlords, especially in the leasing period. Then we were looking at increasing income generation transfer, where women are given more power, where they can earn. And then secondly would be periodic revise revision of the minimum wage sector, because there is a inflation and we need to revise the sector. The wage also increase correspondingly. There has to be a behavior change through communication, where we'll be focusing on the providing education, especially in school level, then intensifying other activities related to education like information education, communication activities throughout the community, and motivating people for utilizing services like family welfare, because the primary focus of most of the program is to ensure population stabilization, and monitoring nutrition programs, the periodic assessment of affected groups, and carrying out research activities on food and nutrition. Some of the long-term objectives were given by the National Nutrition Policy. Then the National Population Policy in 2000, which was framed for attaining population stability in the country by a target-free approach by administering family planning, welfare services. The policy, as I said, was founded in 2000. So some of the major that were there to achieve this population stability were universal primary and secondary education, provision of basic sanitary facilities, empowerment of women for improved health and nutrition, expansion of transport communication network, decentralization of planning and implementation, and increasing participation of men, NGOs, and family welfare activities, because this will increase the more uptake of these services by the population. It had policy set some time bound for some of the objectives. So immediately, what it wanted to do was to provide basic service to people and satisfy the unmet needs of one sector service. Then intermediate level, it was to bring down the fertility level, for the fertility rate to the replacement level, that means around 2.2, and the net reproduction rate to 1. So by this time, we have at this point in time also we have a TFR of around 2.2, and we have another 1.08. It means we have already achieved this objective. And the ultimate objective, obviously, National Policy 2000 was to achieve a stable population in India in 2000 by 2045. A population will be consistent with requirement of social development, economic growth, environmental protection. Looking at the MDGs, as I said, we'll have a look briefly at them. So they were framed in 2000. There was a meeting in New York. It's called as MDG Summit, where members of 189 countries participated. They formulated a resolution which was called as MDG. That means we wanted to look at achieving some goals by 2015. The primary focus was on to eradicate poverty and hunger, achieve universal primary education, promote proper gender equality and empower women, reduce child mortality, improve maternal health, and combat HIV/AIDS, malaria, and other communicable diseases. And obviously, as expected, India was signatory to that resolution. So therefore, India is also was committed to these MDGs, which obviously were framed in terms of goals, and there were targets, and there were indicators given in the MDG document, and there were some alternate indicators also. And we can see if you go through the MDGs, we have been able to achieve significant progress in many fields. So because these MDGs were primarily focused on development issues to sustain social economic progress, and till now we can see they have helped us to reduce extreme poverty, reduce hunger, and get more girls to school and protect our planet. But the achievement has been unequal and uneven throughout the countries and across the countries also. Therefore, what was felt that it needed some revision. Therefore, in 2015, there was another summit where they revised some of these goals. With the primary agenda of that summit was transforming our world 2030 agenda for sustainable development. And therefore, in 2015, this document was called as SDG, the Sustainable Development Goals, was adopted to achieve certain objectives and goals by 2030. So obviously, the primary focus is on reducing poverty, protect the planet, and ensure prosperity for all. The official agenda, if you look at the document of this SDG, it has 92 paragraphs, 17 goals, 169 targets, and there are 304 indicators to monitor the achievement of these goals. The focus, as I said, was on poverty, hunger, good health, quality education, gender equality, economic growth, innovation, climate change, peace, and justice. And some of these specific goals, if you look at them, to reduce global maternal mortality ratio to below 70 per 1,000 live births, reduce neonatal mortality, under 5 mortality, and epidemics of AIDS and malaria, tuberculosis, and combat waterborne diseases and other communicable diseases, reduced by one-third for premature mortality from non-communicable diseases, then strengthen prevention treatment of substance abuse, which is coming up as a problem for us, reduce by half global deaths and injuries to road traffic accidents, ensure universal access to sexual and reproductive health, then achieve universal health coverage, which is now being done throughout the world. And on this front also we have achieved a lot. Reduce death and illness from pollutions and contaminations, which as we know is a problem for both the industrial world as well as the non-industrial world. And therefore, in this video, what we discussed is primarily the policies related to health, some of the important policies. We discussed national health policy, both in 1983 policy in 2002, and then we had the latest revision in 2017. Then we looked at the national population policy in 2000, and then national nutrition policies. As I said, there are other policies also, but these policies are primarily which are mainly focused on health and health related sectors. Thank you very much.